Traditional insurance versus Medibid, take 4. Most Americans that aren't covered by Medicare, Medicaid, or the VA are covered by an employer-sponsored health plan. Employers in America spend a lot of money on health care for their employees. Most of them, it's their second biggest item after payroll. The employee is asked to pay a portion as well, usually. Now, if the employee just wants to cover themselves, it's usually not a huge amount. But if they want to cover their family, it could be a large sum of money. On top of it, they've got a deductible that's sometimes $5,000 or $7,000, and their out-of-pocket maximum could be even higher than that. Now, imagine if you're earning $40,000, $45,000 to have $7,000 before you can even use the plan, other than just doctor's visits and generic drugs. So they've got this huge deductible. Now, from the hospital perspective, here's how it works. The hospital has what they call charge master prices, and that's what the insurance company wants them to bill. And then the insurance company takes a pre-negotiated discount that's very secretive because the insurance company wants the population, the general public, to think that they're getting a really good deal. So let's say the hospital bills $100,000 for a knee replacement. The insurance company takes a discount of 55%, and they say $45,000 is the allowable charge. Now, of that $45,000, the employee has to pay $7,000. Now, again, if you're earning $40,000, $45,000 a year, try to come up with $7,000. It's going to be difficult. So often the hospital will take payments of $20 to $50 a month, and after a year they'll just write it off. So in other words, that $7,000, they're lucky. They're lucky if they collect 10% of that. Let's talk about the other $38,000. Now they have to fight with the insurance company. The insurance company is going to have somebody with maybe a high school education, maybe a year of community college. Sometimes that person's even offshore, not even in the US. That person is going to try to decide whether that procedure was medically necessary and needed to be done. That person doesn't have any medical training most of the time, so they're just trying to say, well, maybe it wasn't necessary. Then that billing person that works for the insurance company is going to say, the first 2 days that the patient was in, they were just in for observation. So that's an outpatient charge, and that's much lower. So they're going to try to get that $38,000 down as low as they can. Often, they won't even pay it because they'll say it wasn't necessary. So of that $38,000, hospital is lucky if it gets that 2/3 of the time. I would even guess that sometimes it's half of the time. So they're getting, for a procedure that they billed $100,000 for, they're getting $20,000, $25,000 on average if they're lucky. That's over a large number of procedures. So we all see that $100,000 hospital charge, but if we see what happened behind the scenes, see all the wheels turning and Oz behind the curtain, we would have a totally different picture. Here's how it works at Medibid. The employee makes a request online. They fill out a few basic health questions. We send it to 19,000 doctors across the US and overseas. Those doctors look at that and they bid a bundled case rate. They give a second opinion. They say whether they feel that that's the right procedure for them. So the employee has a lot of information. They have the quality, the outcomes of the doctor. They have the location, the price, how they do the procedure. Then they pick. We pay the hospital at the time of service in full. There's no $5,000 to $7,000 to collect from the employee. There's no arguing, was it medically necessary? They get paid at the time of service. Because of that, we often get prices that are 50% less than insurance company allowables. Now, the insurance company allowables, those are shrouded in secret too. There are gag clauses. They don't want the public to see what they actually really pay. And that's why they often prevent employers from auditing their own claims. So at Medibid, we've found a better way.